The last group of drugs in this section are called quinolones. It's kind of shortened for fluoroquinolones. These are relatively newer uh, antimicrobials. They're bactericidal. They came out in the 80s, 1980s, so they're not that recent, but they're a little more recent than some of the penicillins and sulfa drugs that came out earlier in that century. So, some examples. I'm just going to run through some of these names so that you hear them. Enrofloxacin is very common in clinics these days. It's otherwise known as Baytril. Marbofloxacin, known as Xenequin, and orbofloxacin, known as Orvax. Those are also fairly common. Um, Difloxacin or dicurol is a dog-only approved quinolone drug, and pradofloxacin or Veriflox is a cat-only one in this country. In Europe, they have it approved for both dogs and cats. Um, Danofloxacin is one of the unusual ones that is still used in food animals. And then we have some human drugs that you hear of sometimes being used in veterinary medicine. Ciprofloxacin is one of the big ones. When we had a bioterrorism anthrax scare in this country, this was the drug that people were prescribed if they were thought to have come into contact with anthrax. And then ofloxacin is a ophthalmic drug for the eyes that is sometimes we sometimes use. So how do quinolones work? They interfere with an enzyme that is called DNA gyrase. And when DNA is going to replicate, it has to kind of unravel, uncoil. And I used to have they had this wonderful animation, the Baytril folks did, and they unfortunately took it off their website. But it would uncoil, the DNA uncoils, and it replicates, and then it has to recoil. And this is where the quinolone came into, or Baytril came into effect, is it would stop the DNA coiling back, and so it would just interfere with DNA, um, translating into proteins and things. So it makes it uh, bactericidal. It kills the cell pretty easily. The spectrum of activity of quinolones is they go after gram-positive and negative aerobic bacteria. So they have to be, it can't be for an anaerobic type infection. So abscesses, that kind of thing. It's got to be more of an open wound, open infection that has contact with the air. So quinolones are pretty well absorbed in dogs and cats, and then um, calves and adult horses. It's not as well absorbed for some reason in foals. And then in adult ruminants, the bioavailability is low. So, especially if it goes into the rumen, it's not going to be as effective as the injectable. But I want to just kind of caution you about these drugs in food animals, and so we'll talk about that a little bit later. Um, Food will delay the onset of activity. So in general, owners don't need to give it around feeding time, but it doesn't really interfere either way. So we don't usually make a note about that. Um, if it's given parenterally, and many of these drugs have an injectable form as well as an oral form, it'll be absorbed really well. So these drugs, I should say, are more on the non-ionized or lipophilic side. So we get some really good accumulation in the the kidney, liver, lungs, bone, joints, and then into the globe of the eye and the central nervous system and the prostate. So that was one of the things that when this drug came out, and I'm talking about Baytril, that was the first one that was approved in this country. when it came out, this was pretty exciting because this was a drug that could get into a lot of different places that other drugs had trouble getting into. It is metabolized in the liver. It's not that you need to know a whole lot about that, but ciprofloxacin and enrofloxacin are metabolized, and there's a variety of metabolites. Enrofloxacin tends to be metabolized into ciprofloxacin. So at least like 40% of it is metabolized into that in small animals. And so sometimes veterinarians will just reach for the ciprofloxacin. What's really interesting about these drugs is that they're carried into infection sites via macrophages and neutrophils. These two uh, um, white blood cells or immune system cells are uh, they somehow take up the quinolones in them, and then when they go into an infection site, they bring it in with them, and so that concentrates it into the infection site. So that again is clearly an advantage for this drug, and it makes them a real drug of choice for pyodermas. We have trouble treating pyodermas. They just take a long time. The surface of the skin, while it is fairly vascular, it is always kind of regenerating. And so um, it can just take a while to really have a good effect with the with antibiotics and skin infections. So these are the drugs of choice pretty much for pyodermas. And this is Baytril. If you've been in a clinic, you've probably seen this purple label on it. It was a very distinctive label when it came out. So quinolones are excreted, both of the metabolites and the unmetabolized forms go into the kidneys, and then some of it is metabolized in the liver and excreted that way. If an animal has a renal um, insufficiency, something going on there, then we want to reduce the dose. We want to give them less of that because that will interfere with how well it is excreted. And these types of drugs, the quinolones, are just like the aminoglycosides. They are concentration dependent. So we usually dose them about once a day, and they just need to reach a particular concentration for a relatively short amount of time. And so they're not time dependent, they're concentration dependent, and then they'll be readily excreted. In general, we think of quinolones as being safe, I'm drawing air quotes, antibiotics. In other words, we don't tend to get that many side effects with them. Animals tend to tolerate them well, but there are a couple of situations where we don't want to use them. The first is in young animals that are growing and have not completely um, uh, developed all of their joint cartilage, their growth plates are closing, things like that. As the joint cartilage develops, this drug will interfere with it and cause bubbling of the cartilage. And that can lead to lifelong joint damage. So it's considered to be contraindicated. Now, your book talks about partial contraindication. So bear in mind that if an animal is going to lose its life, if it doesn't have a quinolone drug for some reason, if there's just nothing else that can be used to treat it, that it isn't totally contraindicated to not treat the animal if you're going to save their life. I don't think that situation comes up so much, but uh, in general, you want to avoid these in developing animals. So, as we know with dogs, it depends on their age as to how fast they develop and how fast that cartilage is formed and growth plates close. So, with small and medium sized dogs, we are talking about holding them off of this for 8 months. Large breed dogs, a year is when we could start to think about giving these drugs. And then the giant breeds, you want to wait until they're a year and a half old. With cats, we wait for 12 months, and foals, we wait for 3 years. So after that, they're really an adult horse. Even 3-year-olds can be kind of more on the adult side. But we want to avoid these in pregnant animals for obvious reasons. You don't want any animal with any kind of developing cartilage to be given this drug. We want to avoid giving quinolones in seizuring animals because it's been found that they can precipitate seizuring. So epileptic animals we would avoid using these drugs in. When Baytril came out, it was touted as being a potential help for a condition that was found in cats. It was a very frustrating thing. Owners would bring their female cats in. They would uh, had all the signs of a bladder infection. There was blood in the urine. But if you looked at it under a microscope, you wouldn't necessarily find any bacteria. You might find some white blood cells. And so veterinarians for years have been treating these with antibiotics, and sometimes it would resolve. Other times they'd be treating it again and again because it just didn't seem to go away. So when Baytril came out, it was kind of touted as maybe this will be good because it does tend to um, be excreted through the kidney, collect in high concentrations in the urine, and um, so veterinarians would try it, and if the infection seemed to come back, they might increase the dose. There was a range in cats of 5 milligrams per kilogram per day. 5 to 20 milligrams per kilogram per day. And so they would go up to that high range if they really wanted to try to eliminate this infection that they thought was happening. Well, it was found that some cats, especially at the higher doses, it would cause retinal degeneration, and that would lead to blindness. So after a few years on the market and these cases having come to light, the manufacturer reduced the dose, and we seem to not have trouble with this particular dose of a maximum of 5 milligrams per kilogram per day. We seem to not have that. We don't know as much about other quinolones as Baytril for this particular condition, but veterinarians are very cautious of these drugs in cats for this reason. What we have found out since, this is a condition called sterile hemorrhagic cystitis. It is a condition, and there's a variety of names, and they keep changing the name, so I'm not absolutely positive what this kind of syndrome is, but um, what we believe now is that stress plays a large role in cats having these recurrent signs. So we want to make sure it's not an infection. If it is an infection, we absolutely want to treat it. But we may go through some other routes of, what's going on in the household, behavioral things with the cats before reaching for drugs these days. In general, if there are older drugs that will do the job, veterinarians are hopefully reaching more for them. In food animals, the worry is that we're finding resistance. So bear in mind that the DNA, attacking DNA sounds really worrisome, especially if you're talking about people and aren't we going to find birth defects? And it only attacks the bacterial DNA gyrase. People have a different enzyme for that coiling of the DNA. But the real worry with food animals and getting this into the food chain has to do with resistance to these drugs. And these are considered medically important in general. It's illegal to use quinolones extra label in food animals at all. And there probably will be a banning of some of the quinolones that they want to reserve just for human use, and especially the newer ones. So it's not totally illegal to use them in food animals, but it's a big caution about which ones, and don't use it extra label because that is illegal. The veterinarian can lose their license. All right, so here's the questions again for quinolones, and I will have another question for you to answer.